Dr. K from Thompson Healthcare and Sports Medicine. I'm here at the Linwood location today. We're going to be talking about hip CARs and why they're so important. We're going to be talking about this joint here. So this is your back pocket and this joint is your hip. So if your hip can't move independently of your SI joint or your back, you're going to actually start to have a lot more SI joint pain and low back pain. So we're going to go over some isolated movements that can help your hip. Today we have Jackie, and Jackie's going to help us learn what hip CARs are. Jackie is a CrossFit coach as well as a PE teacher, so she's very well in tune with her body. Lately she's been having some hip pain and we're trying to correct it. So what are hip CARs? It's controlled articular movements and rotations of the hip or any joint. So we're going to learn some things of the hip. All right, so I'm going to have you just lift here, Jackie. Good. You're going to pretend as if there's a stake going through your knee and your hip. And now we're just going to do some external rotation here. So bring the foot all the way up to you. Hold that and kind of push through that through its end range of motion. Hold it, and then you're going to go internal rotation of the hip and bring the foot out, but keep the knee exactly where it is, and hold that a little bit. Some common mistakes here are with the patient. When you're going for external rotation, they're going to drop the pelvis a little bit, and that's not what we're looking for. We want controlled pelvis movement, so we want to keep the pelvis exactly where it is on the table and externally rotate. And then when we go into internal rotation, what happens is the patient will hike their hip up, kind of like that, exactly what Jackie's doing. So we want to help correct those movements and just have isolated movement at the hip joint and not at the pelvis. So now we're going to progress the movement into a quadruped. We wanted to just practice the internal and external rotation while we were face up and take gravity out of it. Now we're going to add a little bit of gravity and see how we can help the hip a little bit more, okay? So Jackie, we're going to start off by just bringing the knee up to your shoulder. Good. Then we're going to externally rotate up to the ceiling. Awesome. Take this foot, externally rotate a little bit more. Keep the bend in the knee. Bring it back up to the ceiling. Awesome. Now, gently but controlled, bring your knee back to neutral. So in that position, what did we do? We went into flexion, external rotation, internal rotation, extension, and back up, which is going to help differentiate the movement from the low back, the facet joints, the SI joint. So we're trying to really hold the positions. So now I'm going to have you hold each position and just to get a little bit more activation of the muscles around your hip. So we're going to go into hip flexion. Good. External rotation. Perfect. Internal rotation of that hip. Extension. Nice and controlled. Look at that hamstring activation. Beautiful. And back down. The different mistakes made in this movement are also hip hiking, as well as dropping of the foot. So when you're in this position, in this external position, you probably can't get as much internal rotation, which is okay. I want you to just practice to see where you can get it. So do not get discouraged if you can't get into a lot of internal rotation. It is a very limiting range of motion already. So today, now we're going to add gravity and balance. We're going to stand on the leg and pick up the hip and do CARs on one leg. It's going to add that sense of balance to your joints as well as proprioception, as well as now you have to make sure your pelvis is balanced throughout the whole motion. So now we're going to, Jackie, we're going to actually start with our hip and our knee. Bring the knee up into 90 degrees as well as a little bit above 90 degrees. You're going to go into abduction here and internal rotation. Make sure you bring that foot up. Keep that around. So you're going to bring the hip all the way around and up, and you're going to come back to neutral here. Okay, so we're gonna go through that again, and I'm gonna show some common mistakes. So we're gonna start off again, balance on that left side, knee up all the way, bring that knee out. You're gonna bring this up. As soon as you go into internal rotation, your hip's gonna wanna hike. Keep that hamstring engaged, kick the foot back up to the ceiling, good. Drop back down into neutral and drop the pelvis as well as the ankle. So why is that so important? It's really important to make sure we can differentiate hip mobility along with SI joint mobility and lower back mobility. They all work together, but when your hip is stuck in the capsule and can't really internally, externally rotate or abduct, go into flexion and extension, you're gonna grab that energy or movement from your lower back. And that's how you hurt your lower back when you're deadlifting or squatting, jumping, back squatting. So we really want to make sure the movement comes from your hips and those hips being explosive rather than your lower back. So all of these progressions of the hip cars is actually going to give you more stability as well as pelvic stability to move through your hips and not just your lower back. And that's exactly why we need to take the progression from being supine or laying face up to a quadruped position to a standing position. Thank you, Jackie, for coming in today and giving us your time to help us demonstrate hip cars. And thank you for being an awesome patient as well. Again, I'm Dr. K from the Linwood location at Thompson Healthcare and Sports Medicine. If you would like a functional range of motion test or just want to see what your movement looks like, please schedule at one of our multidisciplinary locations. One of our providers will be more than happy to help you.